My name is Kelly Grau, and I'm applying for the master's program in IO psychology. Like many Americans, I followed the often sensationalized news of Thomas Eric Duncan's arrival and ultimate passing while at Texas Health Presbyterian Hospital, Dallas. I was struck by the reports of chaos at the hospital and remarked even then that the facility lacked the composure and efficiency maintained by other Ebola treatment facilities. It seemed that Presbyterian Dallas wasn't merely caught off guard by Mr. Duncan's Ebola infection, but was underprepared for any crisis-level medical event. Preliminary media research and a review of hospital press releases revealed that Presbyterian Dallas made alarming missteps during every major stage of Mr. Duncan's treatment, from his botched initial consultation to the possible mishandling of his specimens. As a result of the crisis and subsequent events, Texas Health Resources now requires an overhaul of many of its processes. The great thing about the Texas Health case is that it doesn't exist in a vacuum. Other hospitals have successfully prepared for and treated Ebola, and there is much to be learned from their example. To gather useful information for making suggestions, I started by studying clinician outreach and communication activity calls published by the CDC, which reported on Ebola best practices of Emory Healthcare and the Nebraska Medical Center. I learned that huge differences existed not only between all three hospitals' handling of Ebola, but also in their pre-existing culture and environment. Even though organizational change can be daunting, costly, and ultimately ineffective, Texas Health can mitigate its risk factors by studying and implementing the best practice procedures of other successful healthcare facilities. My research left me with a better understanding of the problems that Texas Health now faces, but the most obvious challenge for this project was developing concise propositions. I separated and categorized what I see as the most significant issues. After analyzing the negative impacts of each, I was able to construct solutions. Mr. Duncan's initial visit and incorrect diagnosis was a fatal missed opportunity that likely could have been prevented by the more effective use of technology. Though his recent trip to Liberia was documented in his electronic medical chart, this vital piece of information wasn't conveyed from ER nurse to physician. Though it's true that more effective communication between caretakers could have gotten the message across, it's also true that electronic health records software could have sounded the alarm when the combination of Mr. Duncan's travel history and symptoms were recorded. Software developers should work to make such modifications at Texas Health hospitals, and their impact can be measured by studying the rate of incorrect diagnoses at the earliest stages of care. Though ineffective use of technology did play a role in Mr. Duncan's fate, poor communication among confused staff was arguably the most detrimental contributing factor. Leaders didn't mandate that staff attend Ebola training sessions, and as a result, staff weren't empowered to make well-educated choices. The protective measures that they did improvise were in reality questionable. The opposite was true at Nebraska, where staff collaborated across levels and exhibited a sense of ownership during their hospital's Ebola crisis. Leaders at Texas Health need to establish a culture of knowledge sharing and cohesiveness, starting with mandatory competency-based training and team-building exercises. Progress can be measured using performance evaluation practices built on the training, and changes in employee engagement can be measured using employee satisfaction surveys. Finally, Texas Health's operations require a thorough examination. Presbyterian Dallas currently uses a third-party staffing firm to hire, train, and discipline its emergency room staff. It's possible that third-party ER employees are excluded from regular hospital protocol and crisis training, thereby putting certain procedures in jeopardy. Further, the removed nature of the hiring process potentially fails to fully integrate ER employees into the hospital environment. Texas Health needs to revisit its operational procedures and assess whether the benefits of third-party hiring in the ER are worthwhile. To help make the determination, data should be gathered to observe whether internal hires report higher levels of satisfaction and overall competency. I currently work as a senior associate at BDO Consulting. While my experience hasn't included engagements in the healthcare field or been directly relevant to IO psychology, many elements of this project did relate to my ultimate aspirations. It's my goal to work with organizations such as Texas Health to better leverage their personnel resources while improving their environment and overall systems. I thrive most when identifying solutions for projects and am passionate about the client-facing elements of my role. As Texas Health begins the tumultuous process of organizational change, it's likely that consultative intervention will be met with some level of resistance. I hope to learn about this sort of conflict while at NYU and use my IO psychology knowledge while working with companies to successfully weather transformation. Thank you.